In one year, 2.3 million Australians skipped or delayed seeing the dentist because they couldn't afford to pay for it. Now, in a cost of living crisis, we know that there are millions of Australians right now already struggling to pay the rent, already skipping meals, but if they do have a tooth infection or a toothache or oral health problems, right now they have to skip seeing the dentist because for some reason our public health system doesn't cover one of the major components and often one of the most important components of our health and healthcare. In 1 year, in 2021, 20,000 Queenslanders were admitted to hospital because of preventable oral health and dental health problems. We know that 44% of low-income older residents often skip seeing the dentist because they can't afford to pay. It is unacceptable that in a wealthy country like Australia, where fossil fuel corporations get away with making billions of dollars in revenue and often paying $0 in tax, that this government can't find within itself to raise taxes on big corporations and billionaires and use that to fund covering dental under Medicare. If this government really cared about Medicare, the way to defend it is to expand it to cover every part of our body. Like, what is the rational reason why our Medicare doesn't cover oral health? If you chat to any emergency ward nurse, if you chat to anyone in the public hospital system, they'll tell you that they see people being admitted to ER wards with oral health infections, with tooth infections, tooth abscesses, heart conditions that are caused as a result of not being able to afford to go to the dentist and get a cheap checkup. The reality is that if we did bring dental under Medicare, it would save funding over the long term for the government because preventative health and making sure people can go and get a checkup or go and get that tooth filling rather than waiting a couple of years and going to the emergency ward with a massive tooth abscess and infection and potentially heart disease as a result of not being able to go there, well, the cheap checkup is a lot cheaper to the public health system than the admission to the emergency ward. We know that in 2010, in the balance of power, the Greens were able to get dental into Medicare for kids, 3.4 million kids. And the next time the Greens are in the balance of power and potentially after the next election, the next thing we're going to fight for is making sure every Australian in this country has dental under Medicare and can go to the dentist and get a checkup for free.
Authorised by J. McCall, Australian Greens, Canberra.